to the third installment of the new social research evidence to policy workshops. We're glad to welcome our next speaker, Dr. Simon Lewin, who is a senior researcher at the Norwegian Institute of Public Health and Health Systems Research Unit at the South African Medical Research Council. He is an expert in health systems research and systematic reviews, and is the co-editor of the Cochrane Effective Practice and Organisation of Care network. And he also sits on a number of advisory committees at the WHO and leads other research initiatives. Welcome, Simon.
I'm hoping that we'll have an opportunity for discussion at the end, so please do make notes of any questions you have. It's quite difficult in some ways to prepare this talk because I wasn't completely sure of the range of people I'd be talking to, and also I'm a kind of fake social scientist because my background is in a different discipline, so we'll see how it goes. As Stella said, I'll be talking about new developments in using qualitative evidence to inform decisions. And what I'd like to talk about today is firstly just to start a little bit by saying a few words on the ways in which qualitative evidence can inform decisions, to talk about some new tools and approaches in the field, and then sort of finish off by talking about some of the challenges and opportunities in this area. And I'll be drawing specifically on our experience as health systems researchers working in a particular part of the science policy interface, that is, with its scientific advisory committees at the WHO. So most of what I'm saying sort of comes out of our experience in that domain. It may be very different in other places. So this may not really be news to any of you, but of course, you know, we see widely, and it's spreading across multiple sectors, this promotion of the systematic use of research evidence to inform health and social policies, and the growing use of systematic reviews of intervention effectiveness, how well interventions work, to inform policy decisions. So this is, you know, something that's been growing over the last 2 decades. But of course, evidence on the effectiveness of interventions is not really sufficient to inform decisions on health and social interventions or programs. And decision makers need and actually ask for information on a whole range of other issues, including things like the feasibility and acceptability of interventions, so that they can better understand factors that may influence implementation in the real world. And they're also interested in evidence on things like equity, gender, and human rights impacts of interventions. And qualitative research has the potential to be an important source of evidence on these kinds of issues. Qualitative evidence is also important in the context of the Sustainable Development Goals, which really can only be achieved through cross-sectoral policies and interventions. So in this sort of context, qualitative evidence can provide a more holistic and integrated view of people's experiences of health and social issues, with people's experiences, of course, naturally cut across these artificial boundaries that we create between sectors. And they can also help us understand how people view different policy options within their socio-environmental context. And of course, this issue of citizens' voices is another reason why people have become interested in qualitative evidence in decision-making. Because qualitative evidence can represent the voice of a wide range of citizens and stakeholders, and maybe particularly important in bringing into decision-making the views of marginalized voices who are not necessarily represented in the kinds of fora where decisions are being made. So in this way, the wider use of qualitative evidence, including evidence from qualitative evidence syntheses, and I'll say more about that in a moment, may contribute to increased transparency and accountability in public decision-making. I'm sure I don't need to sort of say to you that there are many different levels of decision-making for health and social care, and many different ways you can look at these different levels. One way of doing it is just in this very simple approach here. The decisions that people make personally, citizens make about their own lives, including their health and social issues and care, their decisions that healthcare providers and social care providers make in collaboration, hopefully, with service users, caregivers, and families. They're the kinds of decisions that program managers are making about local service delivery and strategies to implement health and social care programs. And then there are decisions made about how health and social care is governed, financed, and delivered, which is usually happening at another level. And in the talk today, I'll be largely focusing on these two lower levels here, but really trying to sort of think about how we can better understand the views of these groups and to bring them into these decision-making processes that are happening at other levels. I thought I might start by just saying a little bit of background in how we came to be involved in this area of work. In 2010, we were approached by the World Health Organization to help them develop new guidance, or sometimes it's called guidelines in the clinical world, on what they called optimizing health worker roles to improve access to maternal and newborn health interventions. And this guidance really focused on the extent to which these tasks that are done in health to do with maternal care and newborn care could be moved to health workers with low levels of training. It's commonly called task shifting. It's something that's happening in all health systems. But of course, task shifting is quite a complex health system reform. It may require governance, financing, regulatory, and organizational changes to implement it. It may impact on the relationships and flows of information between different health worker cadres and between health workers and service users. It can shift boundaries of care between the home, communities, primary facilities, and hospitals. And of course, professional organizations and unions, service users, and civil society have quite a wide range of views on whether this is a good idea or not. Is it a form of poorer quality care for poorer people? Is it going to change the range of tasks that professional groups are mandated to do? These are all questions that people are asking. So we became part of a technical team that was supporting the scientific advisory committee for this guidance. And because of this sort of complex picture of task shifting, we saw it as important that the guidance not only look at how well these interventions work, their effectiveness and safety, but also look at the acceptability of different options to users of healthcare services, health workers, and other stakeholders, and the feasibility. How easy would it actually be to implement task shifting interventions in different health systems? So this sort of broadening of the approach led to a number of challenges. Of course, when it comes to safety and effectiveness of interventions, for some decades we've had systematic reviews of controlled studies, controlled comparative studies, which tell us something about that question, are considered really the gold standard for assessing safety and effectiveness. But when it came, and also we have this tool, GRADE, some of you may be familiar with it. It's a tool or approach for assessing how much certainty we can place in this evidence of effectiveness. And I'll come back to that a little bit later in the presentation. But this area about whether interventions are acceptable, feasible, and what their impacts on equity, gender, and human rights aspect was a bit of a new area for us at least. And we were trying to sort of grapple with questions like, how do we gather and synthesize findings from multiple qualitative studies about acceptability, feasibility, and impacts? How do we package this evidence and present it to these stakeholders who are making decisions about task shifting for the WHO? And how do we assess how much confidence should be placed in these findings that are coming out of qualitative evidence syntheses? And these are all points that I'll try and say a little bit about today. So this takes me into the next part of the talk, which is looking at some of these new tools and approaches for using qualitative evidence to inform decisions. I'll be talking a little bit about qualitative evidence synthesis methods. Some of you may be familiar with this area of work. About an approach called GRADE Circle, which is looking at how we might assess how much confidence we have in qualitative evidence synthesis findings, how the methods for this area are evolving, and some new tools that are being used in the area. So, of course, qualitative evidence synthesis is just a systematic review of primary qualitative studies in a topic area. And like primary qualitative research, these syntheses aim to explore people's perceptions and experiences of the world around them, including of health and illness, health and social care services and institutions, the built environment, and other aspects of society. And they can also be very valuable in helping to build and develop theories and models that may help to explain the social world. And these types of syntheses have, in recent years, become a key approach for using qualitative evidence to inform decisions in organizations like the WHO, the National Institute for Health and Clinical Excellence in the UK, and in other groups that are doing health technology assessments, for example, in Spain, Sweden, and elsewhere. So qualitative evidence synthesis does have its origins in the social sciences, and these approaches were first developed in the late 80s and early 90s in sociology and applied anthropology. And the first sort of application of qualitative evidence synthesis in health was around the mid-1990s. And since then, a sort of bewildering range of different approaches have emerged. And there's really been a proliferation in the number of syntheses that are being done and published. So if you look at these data, this is just from Medline, so it's not a complete picture. 1995, there were 2 of them, and last year, almost 1,500. So it's almost becoming like primary research. There's many qualitative evidence syntheses as primary studies being published. Not quite, but we may be there soon. And huge range of different sort of related approaches to doing these kinds of syntheses. And of course, critiques of this whole area have started to appear. There's a view, for example, that the newer qualitative evidence syntheses approaches really have a quite sort of technical, technocratic focus and produce findings that are rather theoretically superficial. And linked to this, there's a real concern that these syntheses, the findings of these syntheses may lose touch with the original rich qualitative findings that were in the primary studies. And it's easy to see how that may happen as the findings from primary studies become kind of filtered down and boiled down to a set of synthesis findings. And in that process of boiling down, is context being stripped away and complex phenomena oversimplified? And of course, how are these things then linking back to the disciplinary sort of discussions that are happening in the areas where these syntheses came from? So these are some of the critiques that have been leveled at qualitative evidence syntheses, and that I think are important when we start to think about how we're using these findings in decision making. And I'll come back to that sort of conceptual issue towards the end of the talk. I mentioned earlier on that one of the things that we're concerned about is how do we assess how much confidence to place in findings from these syntheses. So we know from a lot of different areas of work that users of evidence tend to make judgments implicitly about how trustworthy evidence or information is. We all do it all the time in claims that we read in the newspaper or in other media. Implicit bias based on implicit attitudes and stereotypes may drive these judgments. So it can be helpful when we're looking at formal decision-making processes like scientific advisory committees in organizations like WHO to provide a systematic and transparent way of assessing how much confidence we have in the evidence. And this is not only for the people who are making decisions in forums at WHO, but also for the users of those decisions. We need to understand why did they say this evidence was good and that evidence was less good. So it's about providing a sort of systematic and transparent way of looking at that. As I mentioned, in the world of effectiveness evidence, there has been for some time several well-established approaches. The GRADE approach is the one that's probably most widely used, including in WHO. But we needed something similar to that we could use in the context of qualitative evidence, and that was adapted for this particular methodology. And the GRADE circle approach was something that emerged out of our original work in WHO, and this aims to transparently assess and describe how much confidence to place in findings from qualitative evidence synthesis. And it's really just a tool for facilitating the use of this evidence in decision-making processes. So what do we mean by confidence in the evidence in the context of qualitative research? We've defined it as the extent to which a synthesis finding is a reasonable representation of the phenomenon of interest, whatever that phenomenon is. And what we're really saying when we say we have high confidence in a finding is we're saying that the phenomenon of interest is unlikely to be substantially different from the research finding that's emerging from the synthesis. To make that assessment, we look at these four components that you also saw on the previous slide. I don't really have time now to kind of go into them, but we could talk about those more later on if you like. They include the methodological limitations of the underlying studies, the adequacy of the data, how rich and thick is the data, what is the relevance of the data to the question you're asking, and also the coherence of the finding. What is the relationship between the underlying data and the finding that's emerged? And all of this contributes to our assessment of confidence in the evidence. And we apply that assessment to each analytic output of the qualitative evidence synthesis. And of course, one qualitative evidence synthesis can have many different findings, or themes, or whatever you want to call them. So this was one approach that we used to try and help the users of this evidence to understand how much confidence they could place in it. While all of this has been going on, lots of new guidance has emerged on how to conduct qualitative evidence syntheses. As I mentioned earlier, the methods in this area are developing rapidly, and of course, review authors or synthesis authors find it quite challenging now to sort of understand or get an overview of the field and to identify up-to-date guidance. So just towards the end of last year, the Cochrane Qualitative and Implementation Methods Group published a series of papers which intend to provide an overview of this field. And I think will really help people working in this area to get a sense of the breadth of methods that they can draw on. So this is another sort of available sort of set of tools that may be helpful for people who want to use qualitative evidence in decision-making processes. What's also happened is there's been growth in guidance on how you report the findings of qualitative evidence syntheses, and I think this is an area in which we're going to see a lot more coming out in the near future. Several years ago, people published some guidance on how to report realist syntheses using the realist evaluation approach. More recently, our own group within Cochrane has published guidance on writing protocols for qualitative evidence syntheses. And in the next few weeks, the Emerge group, based in Scotland, will be publishing guidance on meta-ethnographies, which is one of the big areas or methods used for qualitative evidence syntheses, particularly in some contexts like the UK, where there have been a lot of these meta-ethnographies commissioned by organizations like the National Institute for Clinical Health Excellence. Another sort of aspect that I wanted to mention was the sort of efforts to widen the range of evidence that are used in decision-making beyond these sort of formalized types of research studies. So what we found in our experience working with scientific advisory committees and guideline groups in organizations at the WHO, as I mentioned, is they're not only interested in how intervention works, but how it works and the details of what are included in programs that they're looking at from across the world. But often that kind of information on how it works for whom and under what circumstances and what's included in these programs is not well reported in things like randomized trial reports or even in qualitative studies that are looking at these particular interventions or programs. A lot of that kind of information is in things like program and implementation descriptions, largely found in so-called grey literature. But they can provide very valuable data on these wider questions. So we started to give some thought as to how we can better utilize program and implementation descriptions as evidence sources for decision making. And in the process of doing that, found once again that there are very few tools available for making some assessment of the limitations of this material. Again, so that we can feed back to decision makers what are the strengths and weaknesses of this information that we're gathering from these program descriptions or implementation descriptions. So we're in the process right now of developing this tool called WEIRD. So we came up with the term WEIRD because we thought the data sources were quite weird, and then one of our colleagues managed to find some words that fitted into that acronym, so we're very pleased. And this tool really aims to guide critical appraisal or assessment of the limitations of source materials such as program and implementation reports. And we can apply it to things like descriptions of real-world health, welfare, or other programs, descriptions of implementation, or descriptions of policy processes and systems reforms. And once again, we can use this assessment of the limitations of these materials to feed into a wider assessment of how much confidence to place in findings from syntheses of this kind of material. And this makes it easier, hopefully, for us to include this kind of material in decision-making processes. Another area that I thought I'd briefly mention, which is helping to take this area forward, are tools for packaging evidence for decision-making. So, as you can hear, I've been talking about lots of different forms of evidence, evidence that answer questions about the effectiveness and safety of interventions, evidence that answer questions about things like feasibility and acceptability. And in the past, decision-making in scientific advisory committees and other forums really looked at this information in a rather haphazard way, if they looked at it at all. And the aim of some of the tools that have emerged is to move away from this kind of decision-making, looking at evidence in a rather ad hoc way, to a more systematic and transparent assessment of the relevant criteria and the evidence for these in decision-making. So what these tools do is they say, okay, there are a whole sort of set of criteria that we think people should be looking at: the size of the problem, benefits and harms, values, resource use, and so on. Let's sort of line up the evidence in relation to each of these criteria, and then the panel or scientific advisory committee would look at the evidence for each of those, make a judgment about it, which should then feed into some sort of overall recommendation or decision. So that's the sort of idea of how this complicated process of decision-making is going to be made sort of into a nice, tidy, linear package. And an example of one of these frameworks you can see on the screen here, I'm not going to go into detail, is the GRADE Evidence to Decision framework. So here, the systematic review authors produce the review or synthesis findings. They get packaged according to the type of question they're dealing with into this framework, where there's space for people to make their judgments. And this is then used to inform deliberations by a decision-making structure. And there are many different variants of this out now. Groups doing health technology assessments use something quite similar. The so-called evidence briefs for policymaking also use this kind of structured approach to presenting information to forums. So really what I was trying to show you in the last few minutes is that there are a range of tools now available for using qualitative evidence in decision-making, including methods for undertaking qualitative evidence syntheses, guidance on reporting these syntheses, an approach for assessing how much confidence we have, and these evidence to decision frameworks in which we can package all of this kind of evidence to facilitate transparent and systematic assessment, hopefully, by decision makers. So in the last part of the talk, I'd really just like to maybe share some challenges and opportunities for using qualitative evidence to inform decisions, and some of the critiques of these approaches. So I've tried to show that qualitative evidence is playing an increasingly important role in decision-making processes, and that these new tools and approaches may support this. And also that qualitative evidence can have much wider impacts by shaping how we view the social world and health and social issues. And the models and theories developed as part of qualitative evidence syntheses, for example, may have a particularly important role in this regard. And we started to wonder, are we perhaps entering a new era for qualitative research in which its value is being increasingly recognized by decision makers and people who support them, and also by other stakeholders? It's been argued, and we've also been part of this debate, that for health systems to function optimally, evidence needs to be transferred sort of seamlessly through this whole cycle where you have the people producing primary qualitative studies, people synthesizing those, groups like the ones we've been involved in that are producing guidance and other evidence-informed products, the people who are sort of responsible for implementing this guidance within health or social care, and then those who evaluating it, creating more primary qualitative research. So there's a sort of apparently this neat sort of circle which constitutes the evidence ecosystem. And one can argue, and as I've been trying to show today, that in terms of qualitative data, we're starting to have an integrated evidence ecosystem for qualitative evidence. All of those different aspects are now in place within the sort of qualitative evidence world to allow data to sort of flow right round. Of course, there are a whole lot of practical challenges to using qualitative evidence to inform decisions. In many settings and institutions, there's a lack of capacity to produce, disseminate, and utilize qualitative evidence and decision products informed by this evidence. And that's a major constraint to ensuring that this evidence ecosystem actually works. There is, of course, a need to... Oh, low and middle income countries, sorry. Yes. We need to build stronger links between communities involved in the different parts of the qualitative evidence ecosystem, including across all the sectors relevant to the Sustainable Development Goals. There are real difficulties, and I'll say a little bit more about that in a minute, about presenting and integrating different types of knowledge within decision processes, including within these so-called structured decision frameworks. And then there are challenges in supporting policy users and other stakeholders in engaging with these different types of evidence and making judgments about that. So, as I think you'll probably agree, this evidence ecosystem approach is rather a sort of linear model of data transfer and use. And contemporary approaches to the science policy interface emphasize much more that stakeholders are negotiating what information is needed, what evidence is acceptable for the policy process, and what the policy options are. And we don't really have a good understanding, particularly in the context of these scientific advisory committees, of how they negotiate and adjudicate different types of evidence that we've chosen to label with these particular labels, to address different types of questions. They come with a huge range of questions in trying to make a decision about a policy option. And of course, across many different kinds of decisions. I talked earlier about those different levels of decision making, but we've also got different types of decisions across sectors and so on. So this is quite a complex domain, and we need further research to better understand how all of this is playing out in practice. We probably also haven't yet done enough to utilize existing theory to help understand evidence use. For example, decisions in health and social care delivery can be viewed as taking place within complex, heterogeneous, multiple actor networks. And these networks involve a wide range of actors who are transmitting and shaping information, which might include stakeholders from the different sectors I've been discussing, these different types of information or evidence sources, evidence structures such as evidence to decision frameworks, clinical guidelines, technologies, all the machines that are collecting, monitoring, and transmitting data on how well health and social care systems are functioning, regulations that govern different aspects of health and social care delivery, and institutions responsible for delivering, monitoring, and regulating health and social care. So all of these actors are playing a part in these complex and heterogeneous networks. And for each decision process, these heterogeneous elements are woven together and assembled into some sort of reality. And this is occurring at different decision levels and time points for this enormous and bewildering range of issues. So while it's been argued that decisions in health and social care ideally involve a combination of the best available global evidence, local evidence, and expert or tacit knowledge, and while we now know quite a lot about how we can produce that kind of synthesized knowledge and package it, we don't really know enough about how people are actually using that and how that evidence is playing a role as an actor within these kinds of networks to shape the decisions or policies that emerge from the science policy interface. Of course, there are other theoretical approaches, many, that might be useful in this area, including work on boundary organizations and their role in managing the science policy interface, and how different actors across these boundaries place different values on the attributes of information. So there are therefore many opportunities for taking forward our understanding of this quite complex and interesting field. So I'm going to stop there, and I look forward to hearing from you about work that you're doing that might relate to this or any questions that you have. Thanks.
Yeah, thanks for the interesting talk. I'm just interested particularly in the last part of the talk, where you brought forth different kinds of approaches, which might somehow provide a more complex image of what evidence perhaps is. And I'd like to hear your reflections in regard to, in a way, the kinds of challenges that, for example, active network theory might bring for our understanding of what evidence is within a specific kind of social setting, situation within which we work, or which qualitative studies are usually used, and then the kind of a very linear street sequence model which we've been developing and also co-developing and describing talk, which seems to me to be a kind of a quest for process optimization thing. So perhaps we should think about decision in these terms. And I see that they at least have some kind of a dynamic relation with the other. I'd like to hear more thoughts about that.
Yeah, I think one of the challenges, there are many different challenges here. I think part of it is, as I say, is that I think we don't really have a deep understanding yet about how these groups like scientific advisory committees, what the sort of process of evidence sort of formation use is in those kinds of structures, and the role that evidence plays as an actor within that sort of multi-actor network. And one of the problems, or one of the sort of barriers to it is actually getting access to the deliberations of those kinds of groups. They're often not easily accessible to the public. So even where they make their documents available, which WHO does, what you see sort of written down, all those artifacts that emerge, are not really a good reflection of the process that's happening there behind closed doors. So there has been some work that's been looking at committees, for example, in NICE and in some other structures. But I think access has still been an issue there. So that's just sort of one practical aspect of the process. I think the other issue, and we sort of, I suppose we're in that tension ourselves, is that when you're commissioned to do work for these kinds of groups, it's quite easy to sort of find yourself drawn into that very linear approach, because you're in a kind of production line of you have a commissioner with all sorts of questions or demands. You're trying to kind of create the evidence that these committees can use, and it's quite challenging to sort of build into that research that's going to help you unpack this in a very different way. So maybe we're not the best people to do it in a sense. I think the other sort of aspect of it is that some of these theoretical approaches are not really intended to be predictive. So they're not sort of intended to tell us how to do this better necessarily. They're about creating an understanding of that environment. And then how do you build a bridge between that and the actual practice within these organizations, which have their own sort of internal structures and logic driving and timelines which are driving these processes in a very particular direction. So for me, those are some of the challenges in bringing together this more theoretically informed approach to understanding the science policy interface and what's going on in the practice of engaging with these organizations as technical advisors or whatever you want to call us. I'm not sure if that completely answers your question.
Yeah, well, it was exactly looking at the tensions which the model and trying to understand specific social settings using product.
Yeah, yeah. So I mean, I think I'd like to see much more of that happening, and I think there are these opportunities because there's a lot more organizations are starting to take this approach to decision making, and I think there's always a danger that it's what's the word? It's giving an overly you can use all of this language and rhetoric to give an overly rosy picture of what decision-making processes actually are in these organizations by sort of mobilizing this rhetoric of structured approaches, systematic, etc., etc. You can make things sound much more transparent than they actually are and bury a lot of the processes that happen at the interface away somewhere. So it's in fact, I think we might be part of the problem in that we're creating techniques that allow people to hide decision making away. Yeah. Yes.
There's somebody from the internet.
Yeah.
Somebody from the internet wants to know how acceptability is defined. There's one of the criteria is public opinion embedded in a specific culture, or how do you define that?
Yeah, we actually have tried to define acceptability. I can't remember the definition off the top of my head. But what we're really trying to look at there is what are people's views on these different interventions or programs within a range of different sort of contexts. So I think one of the challenges we've experienced there has to do with when you're working at the global level like WHO, and it's almost like a contextless environment because they're trying to produce guidance that's supposed to be relevant to the whole world, which of course is an impossible task. So what we're trying to do in these qualitative evidence syntheses is, say we're looking at the acceptability. At the moment we're working with WHO on a guideline on digital interventions for health. So one of the interventions they're interested in is the use of things like mobile text messaging, IMs, and app-based messaging to share information with people about health issues. So there we've gathered sort of all the qualitative studies that are available globally about what people think about that. And then sort of trying to look at, okay, what commonalities are there that are coming out across different contexts? And interestingly, there are a lot of issues which are common. I suppose it's not that surprising. The most prominent are, in this particular case, around issues like privacy and confidentiality of information that's coming through to people on their mobile phones. But then there are issues that are quite specific to particular environments. So I think the challenge is trying to capture both of those when you're working in a global level. When you're working in a more sort of narrow context, I think it becomes a lot easier. You can look at what's going on in Finland or South Africa or Venezuela. Yeah. Sorry, won't you repeat the second part of the question, Simon?
It was just also about the definition of.
Oh, okay. So, yeah, I think there was a question from you.
Yeah, thank you. My question, I guess, is more about like the political context of the rise of interest in qualitative systematic evidence. My understanding is that these SDGs are mostly focused on quantifying very complex phenomena and then providing think, ways to monitor progress on the target and also establishing particular targets in quantitative terms. So I'm interested in this kind of global drive towards quantification versus then this new rise of qualitative evidence for the relationship between these processes. And
Yeah.
do you see that the work that we're doing would be a kind of stepping stone for quantification, or how do
Yeah.
those two fit together?
Yeah, I hope it won't be a stepping stone for quantification. I think our experience working with people in these decision-making forums is that they're the ones coming with questions that can't be answered well by quantification. But they don't necessarily express it in that way. But as soon as they start asking questions about, well, is this going to be acceptable to this stakeholder group? Will it be feasible to implement this in my setting? What impacts is that likely to have on women's access to healthcare, et cetera, et cetera? You need to use other kinds of strategies to address those kinds of questions. I don't really have a good sense of why that perspective hasn't necessarily been incorporated into approaches to assessing the extent to which we're achieving the Sustainable Development Goals. And I suspect it's the usual reasons about what's easy to measure rather than what's useful to assess. But I think when you actually move into forums where people are looking at how to implement programs and interventions to achieve the Sustainable Development Goals, they'll be wanting this kind of information, regardless of what that they're asked to provide at the global level for monitoring. Yeah, at least that's my experience. But what is your view on that?
Well, I don't really have a view on that. I'm just interested in actually the quantification of education, the digital. And I just see that there is an enormous drive to quantify very qualitative things like learning.
Yeah.
So I was just, while listening to you, this question came to my mind, how to relate it qualitative and quantitative. Driven processes. Just a question I have also in my mind now.
Yeah. Yes.
Just a quick follow-up on the so I think perhaps it should be useful to distinguish the drive of quantifying and then the drive for a new drive for objectivity through meta-analysis as such. So I think those are different. Of course, they both quite often go together, but they are different. So you want to achieve objectivity, and these are the kind of two discursive tools that you can use. You can talk in terms of numbers, or you can talk in terms of meta-analysis, because many people have used these procedures that no individual bias or political. There's a brand new paper in theoretical theory by several people about the new scientific objectivity in terms of these prevalence of these new meta-analysis.
I think that's true, perhaps meta-analysis used for quantitative data, but it's interesting within the qualitative evidence synthesis domain. There is interest in that's growing in the use of reflexive methods within those approaches. So I think they haven't lost touch with their origins in those qualitative methodologies. But I think you're right that there is a challenge in doing that, while at the same time sort of operationalizing these systematized synthesis approaches. So I think, yes, something we need to really think about.
More questions? Thank you.
Okay.